Hey, I am going to come to you today to talk a little bit about scoliosis. So, this is a topic that is kind of like the classic back problem that you can think about, right? I know at least when I was growing up, they'd have us like single file in middle school, like walk into the nurse's office, and everyone had to like bend down and touch their toes, see if they had a big old rib hump, and you either had scoliosis or you didn't, and that's kind of how you found out. So if you can relate to that, just drop a like or a comment in the section like, yep, I did the bend over and touch my toes. I don't have scoliosis. So that's a way a lot of people find out that maybe they have scoliosis, and they're like, should I care? Like, should I tell my mom? Like, that's kind of how people find out. A lot of times people even find out when they walk into a chiropractor's office and get a set of x-rays, or they find out way later in life and they have just no idea. They're like, really, scoliosis, should I care? Or maybe they don't even have it from when they're a kid. Maybe their spine starts to get arthritic and have degeneration, where the space between your vertebra and your back gets smaller and smaller and smaller and smaller, and then it slowly starts to just tilt and rotate. So there's all different types, there's all different kinds, and there's all different things that can happen with scoliosis. So I just wanted to talk a little bit about it, talk about how chiropractic can help, and also talk about how chiropractic can hurt if you don't know what you're asking for and you don't know what you're looking for, and just prepare you for this a little bit. And if you have scoliosis, I just want to give you a little bit of hope that things can get better. So a little bit of full disclosure, I am so lucky and blessed to have a dear friend of mine who's also a chiropractor, who I love to go to get treated myself and trained with, who has scoliosis. And so most of what I know comes from someone who has a firsthand experience with this condition, who can tell me, never do that on someone with scoliosis. Definitely do this every time. This hurts, this helps. Don't do this, yes, do that. And there's a lot of chiropractors out there who have this sort of training and knowledge. And so just make sure that you feel like you can ask the right questions. You're going to someone who knows what they're talking about and who's willing to kind of look at things in a little different way. This is not the type of person who can just like, hey, my back hurts, and it's better. It just doesn't work that way. Scoliosis is different. You've got a different spine, you've got different biomechanics, you've got a different set of rules that you have to live by. Okay, so first things first, you can have it from birth. You can find it either on that bend over and touch your toes test, or you cannot, because all they're looking for there is whether one side of your back sticks up kind of more than the other. So it can be, you're going to have a curve in your spine without having scoliosis, because it has to be at least 10 degrees in order to be called scoliosis. But you should still be treated kind of like a scoliosis patient if you have a curve like that. And the reason why is because we only use our bodies more and more as we age, and as you get some arthritis and as things start to degenerate and wear down, then you can tend towards more of that curvature. So it's just very important to be an advocate for yourself, know what you have going on, know what's going to work for you, and communicate that really well with your chiropractor. So quick lesson on the spine. We're going to go back to the basics. I brought my friend. This is Fred. He loves adjustments. Okay, so this is your spine from the front, okay? Pelvis down here, full spine, lumbar spine, thoracic spine, cervical spine, and base of your skull. Okay, this is your spine from the side. So from the side, your spine should be nice and curvy. It should go forward down here in the front. You should have a nice forward curve. Let's see. Should have a nice forward curve, and then your shoulders should be rounded a little bit more, not too far forward, but just a little more forward, and then your neck should have a backwards curve as well. So see this nice S shape here? All right, from the front, your spine should be straight up and down. No curving. Fred has a little bit of an acquired scoliosis from me hanging out with him. So you should be straight up and down. Scoliosis happens when the front view of your spine has the S-shaped curve. The side should have it. You really want to have a nice curve in your spine up here and a nice curve in your spine down here. That's how you hold your weight comfortably and don't become compressed and in pain all the time. But from the front, should be straight up and down. So not straight up and down, scoliosis. Okay, so that's what that means. A lot of times people are like, I have scoliosis, I have all this pain right in my rib cage, and I don't understand it. Why does it hurt there? Well, what else is important to think about when you're talking about scoliosis is to think of the body and the spine as a 3D figure. So we tend to go like, okay, just from the front, got it. It's got to be straight, done, sold. But it's not just about that. Are the vertebrae that are straight up and down or curvy also rotated? Are they also tilted? Is the pelvis tilted, causing the spine to be even worse? Is there also a forward head carriage and a rotation and a tilt? There's so many things that can be going on. And so one question I get a lot is like, why do I have all this rib pain? Why do I have heart palpitations? Why do I have anxiety and nervousness? And so the reason why is because your rib cage comes from your spine and is a big cage, literally rib cage, that protects your heart and lungs, that comes all the way around to the front. So guess what? It houses your heart and it houses your sympathetic nervous system, which is your fight or flight nervous system. So when there's tilting, twisting, compression, and pressure in that part of your spine, you can absolutely feel that in your chest, in your heart, anxiety. You can get reflux and bloating right here. And you can even get numbness and tingling. You can almost feel like someone's tickling your back and like something's tickling you or scratching you and you don't know what it is in the middle of your back. Sometimes it can almost feel like a heart attack pain because you pop a rib kind of right out of place a little bit and you don't know what's going on. It's the worst pain you've felt ever. You're panicking. You don't know how to feel. Turns out maybe you have scoliosis. Maybe you just have a rib out of place. But if you have scoliosis, you're definitely likely to experience one of those symptoms at some point in your life. So think of it as a 3D figure. You've got to have a chiropractor who knows how to look at things from the front, loosen things up from the front. You've got all these muscles in the front of your body. You've got your rib cage. You've got your breathing patterns. It all is connected and important and related with scoliosis. Got to look at things from the side. You've got to look at those curves. Are the shoulders and the head forward? Is there too much curve in the low back or too little curve in the low back? You've got to know what's going on there. That's very important. You have to know if things are rotated and twisted. And then, of course, you have to know if they're tilted, which is what the scoliosis itself is. Okay, so some of the other kind of things you can have with scoliosis is pretty much anything anybody else with a bad back has, only you get all of it all the time. So you have, you can have numbness and tingling on the legs. You can have constipation. You can have chronic, like a really terrible arthritis and arthritic inflammatory pain, chronic pain that way. You can have headaches. You can have tension throughout the body. There's all kinds of things. And so the reason why chiropractic helps is all chiropractors, not many chiropractors can agree on many things, but we can all agree on the fact that we restore function in bones. We take bones that are stuck in relation to the bone next to it, and we unstick it and make it move again. At the very, very basics, that's what chiropractors do. There's a lot more stuff we can do too, but that's the very, very foundation of chiropractic. So if your vertebra gets stuck in this tilting, twisted, rotated, compressed structure, they need to be unstuck. They need motion restored to them. All right, well, Dr. Sara, sounds like it's pretty simple. Go to chiropractor, get your bones moved, things get better, done. Right? No, not so much. So with scoliosis, this is a different story. If you've had it from the time when you're a kid, or even if you have it when you're severely degenerative, there are some types of scoliosis that can improve and can absolutely get better. But there are other kinds that really, it's a matter of making you comfortable, make you function as good as possible within that structure. And you just are going to have to take a little extra care of your spine. And if you're a person with this type of scoliosis, you will know because you've always had pain. And when you find a chiropractor, you will not mind at all because it will make such a big difference in your life that it will clear up so many things. But you're going to be one of those people who just needs to take a little more care of themselves, a little more self-care, a few more adjustments than other people, a few more massages than other people, some different types of stretches. There's nothing wrong with that. And as soon as you get excited about it, you have a whole world of amazing treatments you can look into and do to get yourself better. So the other thing that is really important is you can't just restore movement to all the bones in a person with scoliosis. And the reason why is because it's essentially, it's an unstable structure. So the spine was designed to be very stable. Just like I went to chiropractic school in St. Louis. A perfect example of a curve making something a more stable structure is the arch, right? So that curve provides stability. We see arches all the time in physics and in architecture. It's because it's a stable structure. Okay, so those curves in your spine create stability from the side. When you add another curve from the side, that stability is lost. So if you've ever gone to a chiropractor and you have scoliosis, and say they laid you on your side and they adjusted you or did whatever they do, and then you left and you thought, oh my gosh, I actually feel a lot worse. I feel very sore. Chiropractic is the worst. Well, it's not chiropractic. It's just that doctor didn't know your body that well yet, or maybe they weren't as experienced. But I would like to encourage you to try to find someone who knows and is very experienced in treating this, because it's just a slightly different approach to take, and it makes all the difference. We have to loosen up your muscles. We have to restore your function. We have to get you feeling better, but less is more. When you do too much, you create more instability. We have to maintain the stability that you do have, while also providing you some symptom relief and loosening things up. Okay? So the biggest, most important thing to remember is that you've got to find someone who's experienced. If you've hung in with me this long, you probably are someone who has scoliosis or has a friend or a loved one who has scoliosis. And please just, tag them in the comments, let them know, share with them what I've said today. It doesn't have to be here. It can be anywhere. But I want more people to know that there's hope. And there's a way to feel really good and to optimize your body's function even within that structure. You don't have to climb that uphill battle of I have scoliosis my whole life, when you could be helped by just a little bit of a different inspired approach, if you will. Okay, so thanks for tuning in. Like us, drop a comment, say hi, and otherwise, I hope you guys have a really great day.